Migao mar thieth ma Siaya keto okenge mar gayo weche mag iemo hiu e kinde ma skunde iloro niendi, ka laktar Bob Awino kwayo joma tayo chenro no e migao mar thieth ni gibed akicha.
Community kuna kazi, sio? RH program kuna kazi, HIV program tuko na kazi, sisi sote tuko na kazi, so that this girl mwenye amefunga shule asirudi na virusi, asirudi na mimba, si ndio? When January comes, looking at the new infections, still the young people living with the new infections. Though I know we've made strides, but thank you also for bringing our community on board. How do we maximize the services at the facility level? And long gone are the days when we used to have a standalone youth-friendly centers, isn't it? Currently, we are talking about integration. HIV is talking about integration because we are dismantling the CCCs as they were known, isn't it? They are not going to be there anymore. We want a place where I can go in. The only thing we need to do is to capacity build staffs so that any staff can handle the youth affairs, isn't it? So some of our staffs handling a youth is a big problem. So the moment we are integrating all this, are all our staffs capacity built to handle matters pertaining to the world, because if they are not, they'll come and disappear.
Jokanyo matayo weche mag thieth noyudi ni weche okimi osechako dok chien Siaya, ka giseyo jolupo magiwacho ni pod nyayo tuono endo, kendo obila ne be okwani jokonye thiro wach mag tuono.
We have to talk about, if you look at the data for Siaya County, compare from 2020 to date, you realize we have a decrease in teenage pregnancy. As much as we've not reached where we want to be, but there is some considerable decrease that has already been registered. We have one youth-friendly center. We have youth-friendly services being offered across the county in various sub-counties. The board owners are really misbehaving. Even our security agencies are not helping us. As part of security, you find girls have to compromise for their sexual needs. You find boys, because they would like support, and in immediate after sponsor for their own security. So what are the challenges that we see? The specific health issues, a lot of teen pregnancy that is coming out as a result. We are seeing a lot of menstrual hygiene issues. For menstruation, it is a bargain. The girls don't want menses, but they also have an issue when they miss the menses. So we're seeing a lot of menstrual hygiene issues in real life, and it's costing them.
To coordinator mochung ne thiro weche mag okimwi Siaya Zilpa Imbuye to nolero moko kuom gik mamiyo nyithindo go yudo iemo hiu gi tuoche, kolero ni muonyo yath mar family planning eyo.
Sitting on PrEP. It is the other issue of continuing with the PrEP as long as you are on ongoing substantial risk of acquiring HIV. So long as you have a sexual partner that you don't know his or her HIV state, you are at risk. So unakula nini? What are you eating in that instance? Unknown status. And most of the unknown status zinakwanga
Positive.
zinakwanga status that have never been known. So you don't know what you. So as long as you have a sexual partner, Millicent Tomolo, and you can imagine those days you were youth, how many of your sexual partners did you know their status? And in this era of exchange with pads, with school fees, with chips, with rent, why couldn't you add rent? Yeah, because most of our youths are in college, and rent is an issue. Rent? Is rent an issue?
Is that in terms of addressing these issues in policy formulation, I think at some level there are policies that is being formulated for adolescents, young people, reproductive health. There's a collaborative effort. Like now we are doing this with partners among stakeholders to address the emerging issues around the youths. reproductive health. Then service provision. These PrEPs and FP commodities are provided, they are available, and there are services in some of our facilities, most of them for youths. The gap that still exists is information is still not adequate to the community or for youths. The dissemination of information is key. So in our situation in Siaya, we see where there are also, even in household level, there is some people parents that disown the children because of their situation. For example, if a child, maybe because of early pregnancy, if you are pregnant, a family members of your family, fathers or mother will disown you. So those are some of the examples.